Sweden has been both a country of immigration, people moving out of Sweden, but also a country of people coming in. Until Second World War, for instance, the mid-1800s, we have had people actually moving out, mainly due to poverty and other kinds of reasons. Since the World War, since the 1930s, people start to come in, both for work-related reasons, because Swedish industry was booming, we needed more workforce, but then we also took in a lot of forced migrants in terms of refugees and asylum seekers. From Chile, for example, then the 90s from the Balkans, and then Iraq, Somalia, and so on. And now recently, forced migrants from Ukraine. During the period 2014 to 2016, Sweden was one of the largest recipients, one among the top 5 recipients of asylum applications in the world. So a large majority of the migrants that come into Sweden right now are labor migrants to work in the automobile industry, to work in the IT industry, for example, from countries like India. All this results in the fact that around 20% of the current Swedish population are foreign-born. Refugees and migrants have more or less full access to care, but then there are also certain groups where the access are limited due to legal reasons, but also due to language barriers and a lot of other factors. Having that rich migrant history makes Sweden a unique position in providing education and training in migration and health.
A university is pretty much occupied with research and education, but that's not the only task that we have. We actually have to make sure that the research results that we have are implemented in clinical care, for instance, or translated into practice. And having workshops or courses or providing education is a very good way for us to make sure that whatever research we come up with can actually be used in clinical care or in society.
I deal with migrants, health and ethics every day. So when I found this course, I was very glad because I think that could really help me to get a better understanding and help the people I meet in a better way to give them better care. So this course was kind of perfect for me.
Currently, I'm working at the Swedish Public Employment Service, and my main role is assisting newly arrived immigrants to Sweden to help them to come into the Swedish labor market. The course has contributed in my better understanding that migrants' health is affected during migration. During the course, we have discussed and covered the various definitions of migrants, the migratory journey, and the challenges it entails. We have also discussed about how belonging to a particular group and also taking a particular journey can entail in additional health challenges. And all this knowledge will help me in understanding and also in seeing migrants that I meet in work-related situation, to see them from a holistic perspective.
The idea of the course is not to actually tell them how to treat a particular disease. It's not that specific. Rather, what we try to discuss is the public health perspective on refugee and migrant health, and how ethics and human rights and other aspects cut across this spectrum, and how that actually influences health. What we will discuss today is actually social determinants of health, or rather migration as a social determinant of health. So hopefully, with this course, they will develop a much more holistic view of migrant health. And when they have a client who is a migrant in front of them, they not only see that individual, but also understand the wider context where he or she might have come from and the long or short journey that individual might have taken. This will give them that bigger view.
I think the most important thing the course brought with me is my view of seeing the world is not the only one that we could see from different angles and different. To be curious about that. When I took the course during that period, I changed job actually by then. So I worked as a child health care nurse. So then I met a lot of women from Eritrea, and they were all with newborn children, and they were all kind of hard to reach. and came up often to me and asked questions about the child and had hard time connecting to the child. And then also at the course you get reminded of the travel route they have been through, and all of them have passed through Libya. And then we had discussed in the course how it could be to be in Libya for a refugee. And then I was able to ask them about the route and how they ended up in Sweden. And they all started to talk about a very traumatic experience. And then I could slowly start to help them to get some help for the traumatic experience and give more patient and more time and gain trust. So the child started and they could connect more to the child little by little. Since I was working a daytime job, it was very good that it was evening time, and also that it was stretched through a whole semester. So the work wasn't that intense, that the courses tend to be in maybe 5 weeks you should go through a lot, but now it was a whole semester, so you had got time to reflect and do a little by little, and evening time was also very good.
There is a quite strong move now to make courses more easily accessible by making modules or MOOCs, stuff like that, that are more open courses, where you don't need to go actually through the university with applications and so on. You just register to a course or a lecture. That's a way to open up, and that is also something that is asked for by, for instance, people working at hospitals. They need to develop their skills and knowledge, update their knowledge. So there is a need for these shorter courses, and the universities are not there yet, but we are moving that way.
We have a large number of courses that are linked to the important area of migration and health. And this was a strategic initiative from our Vice-Chancellor. So this is an area where Uppsala want to contribute. We want to contribute for a better world, and this is a very important area for us. This spring we arranged a workshop focused on how to help refugees, how to help migrants in the health area. So we invited participants from Ministry of Law, Ministry of Justice, from a large number of countries. We met, we discussed, we developed guidelines, and we aim to continue work this way so we can contribute.
What I believe makes us unique is that we also host the WHO Collaborating Center on Refugee and Migrant Health Data and Evidence. This is quite unique because this is the only one in Sweden and the third currently globally. What this gives us is that within the Collaborating Center mandate, we are supporting WHO in several activities. So what we started was to develop actually a guidance on how to address health in immigration detention, and also how to improve the use of alternatives to detention. We also support WHO in providing technical assistance to specific countries. Publishing guidance is one thing, but we also need to help the member state to implement, to adapt the guidance to their context. The best way for us to do that was to create this workshop.
My collaboration in this course is to give the good example of how we build up our work through mental health in detention, just to tell how we build up and what we do, about the training, the trainee that trains the staff later on. So we try to get the staff to know and understand people with health care issues.
The workshop itself was very useful, and it was very interesting to hear the experience of colleagues from other countries, how they solve the problems of detention of foreigners. It was very interesting to hear experience about the detention impact on the health of individuals, and also the discussion itself of possible alternatives to detention.
The University of Uppsala gives a great opportunity because these courses are needed, and it's not a lot of them. People that will work with asylum seekers, migration, or even detainees need to understand and know what they're going through. So this is a good way to prepare them for the future work they're going to do.